All right, welcome back, everybody. The United Health Foundation is out with the latest edition of its 2022 America's Health Rankings Women and Children Report, which aims to paint a clear picture of the overall health and well-being of our nation's women and children.
So here to tell us more about this and to shed some light on Connecticut's strengths and challenges when it comes to the health of our state's women and children is Dr. May Renee Hernandez, Senior Vice President of Healthcare Strategies and National Medical Director with United Healthcare. Thank you so much for being here, Dr. Hernandez.
Yes, hi, good afternoon. Thank you for inviting me. This is such an important publication. It's a 6th year and is published annually, and it looks at and focuses on the healthcare and well-being of both children, infants, and women. Obviously, they are an important part of our population, as they actually are 40% of all the persons in our nation. The report looks at it's multidimensional. It looks at many, many different aspects of health and well-being for the women, things like socioeconomics, physical home environment, and also behavior, mental health, and access to care. So it's a very good report to have, and lots of information about the state of our women.
All right, it has been out for 6 years, as you just mentioned. So we have pre-pandemic data, and then we have post-pandemic data. Was there a dramatic shift in the research? In the consequences, in the findings?
Yes, it has. Actually, again, we did some comparison and some high level, and this is a report that ranks basically all our states. It looks at the health status of our women and children, number 1 being the best in health status, being in number 50 being the worst. Some of the highlights or takeaway within our nation as a whole is that the mental and behavioral health of our women and children have actually decreased. Yeah. There's a lot of challenges in this space, especially also there's an increase in maternal mortality to women basically on the ages of 40 to 54, especially, when you're looking at that first year of COVID-19, you're seeing that mortality and morbidity increase. We're also looking at the data, and it shows that these variations vary greatly depending on the geography and the race and ethnicity and the socioeconomic factors of the population that we're looking at. Alarming data showing things like, not only, highlighting the disparities in the mental health and other measures such as, for example, unemployment, and also things like firearm deaths and amongst our adolescents has also increased drastically within the last decade in our women and in this population.
So Dr. Hernandez, we just talked about some of the broader topics that we're finding in this study, but what about specifically here in Connecticut? What are we discovering about how we stack up across the state here?
So I have good news for Connecticut, actually. I'm glad to be the bearer of good news. Actually, if you look at Connecticut, it ranked 6th in the nation with respect to the health state of both women and children. It actually prides itself to having low child mortality rate, in addition to also low prevalence of having women with multiple chronic conditions and low teen birth rates, which is great. Yeah. It does have some highlights, some challenges, though. There's always opportunity, right? Even if you're among the top 5 for better and a better status. The challenges in the state are basically looking at things like prevalence in asthma. So it was high in Connecticut. And then also there's a lot of racial disparity between the children who are identified as other race by comparison to that of the white children. And there's also high prevalence of women with high risk HIV behavior. So those were some of the highlights of the challenges and opportunities that Connecticut actually had this year.
All right, Doctor. Yeah, very interesting. We have to let you go. Unfortunately, we're out of time, but we appreciate your shedding some light on this fascinating report with us.
Yeah, thank you so much. If you'd like to learn more, you can find the full report online at americashealthrankings.org. That information you can find right now up on your screen.